service lines are really just a condition. For us, the big ones are cancer and heart care, right? Well, every patient comes in whether they have a heart attack, heart failure, whether they have colon cancer, prostate cancer, everybody's coming in with something different. But what can the system do at a population health to solve for that? Well, okay, go back to what I said, which is what do patients want first? If I'm sick, I need to see somebody.
Yeah.
I need access.
Access.
And when we say the word access, people love to make it this nebulous concept. Our team have really defined it as, no, if you have cancer or you have a heart condition, access is speed to treatment.
Man.
Can you tell me how quickly you're going to help me with my problem?
Yeah.
Speed to treatment.
Yeah.
And then the second is, and then can this not be a miserable experience?
Mm-hmm.
Those are the only two things that as a system I can solve for. And so what do we have to do? Well, there are thousands of things that go on behind the scenes. But from the patient's perspective, it's what have you done to give me my speed to treatment and made sure that forget the complete negative of I don't want this to be a miserable experience. In fact, can this be a great experience where I'm like, you know what? Not only was this not bad, I actually feel better about the team that's treating me and the system that's treating me. And I know we're getting into it for the Black Men's Health panel, but I'm comfortable telling people, no, it's okay to go to the doctor. It's not a bad experience. We need you to go and get seen earlier because, as you and I were talking before, I am a hospital medicine doctor. My entire practice, when people come to me, I say, Dr. Johnson, I want to see you. You never wanted to see me coming because the only time I was going to see you is when you're in the emergency department and I'm about to admit you to the hospital. It's not a place most people want to be.
Right.
I don't want our patients in our health system in our hospitals unless you need to be there. I'm so sorry.
Right. Something important's happened on ESPN. We got to know.
We've got to get you. If you need to come to our hospital, we are more than capable of taking care of you. But we have thousands of clinics. I'd much rather that you get your care there and that you stay home.
Mm-hmm. So true. And I think the mentality. So there are a few things I want to bring up there because the first one. Let's start with my first question. Is when it comes to Black men's health, we ain't going.
Nope.
like I'll make sure I have the links to some of these some of the research in the description of like the numbers of Black men that don't even have a primary care provider, but we're just not going for multiple reasons. Like I can't. We'd be here all day.
Yes, there are historic reasons, there are personal reasons, there are any number of reasons.
There are any number of reasons. But what is that? Like you said, we wait and wait and wait. Oh, no, I don't need it. Or I've heard, I feel good.
Yeah.
Right? Next thing you know, they're seeing you.
Yeah. Well, I would actually tell people, and I would say it jokingly when I was seeing patients consistently of, the minute that I was in the emergency department, I was like, Doc, I've never had to see the doctor. I would immediately go, oh no, this is going to be something pretty close to catastrophic because that time period usually means that, anecdotal, but, oh, well, you're going to have something serious wrong because it's gone without. You look at historically, there are any number of things. Tuskegee syphilis study, anything that documents health disparity of the number of reasons why so many Black people historically said doctors they treat us poorly and we get poor outcomes that are going to do bad things to us. There's a ton of history to reinforce that. And you can look for it for the past 80 years. It's been well documented. Sad, but well documented.
Right, yep.
They're personal reasons. I've been in every single market from our market, Sioux City West, to both the Butte and the Quad Cities in the East. Everybody has said the same thing to me, which is, hey, even if I want to go, transportation is no joke. I can't get there.
Yep.
And typical healthcare access is at a bad time, and there are not enough people, and they're only giving me one appointment, I can't make it. I have a job to
Yep.
do, and I got to put food on the family for me and for me and mine. There are any sorts of reasons why people don't do this and don't seek primary care. We don't make it easy right now. Part of my job as a chief medical officer for the system is to work in partnership with our physicians and our structure to say, how do we structurally change? So that way, when I say speed to treatment, first treatment should be screening.
Mm-hmm.
Your first treatment, I'm going to look in the camera and say, your first treatment should be screening for prostate cancer. Your first treatment should be screening for colon cancer. Your first treatment for heart disease should be getting your blood pressure
Yeah.
and your cholesterol checked. But we don't think about it that way because we all say the same thing. I say it too. I'm going to change my diet. I eat terrible.
I'll go next time.
This cheeseburger, this is the last cheeseburger I'm
Yep.
going to eat. I'm going to be all right. We tend to avoid those things. But if we're thinking of how do we get upstream and how do we help ourselves to avoid the catastrophic, to reduce, we're going to talk about it at the panel, but in this state, the state of Iowa, according to the Iowa Cancer Registry, black men have a 25% increased likelihood of prostate cancer.
Yep.
That's a big number.
Yeah, and if you're not worst of all, with the innovation in that space, even more treatable, right? But like, if you're not doing the things, you're not doing the screenings and catching it. Look, I think black men, you can get 40 years old, at 40.
Yes.
Right? Mm-hmm. Like, if you're not doing that and you're waiting, there's always too late.
There's consequences to waiting, which
Yeah.
is why, unfortunately, we brought up cancer and cancer screenings. You can get blood tests to be able to do this. Now the colon cancer screening tests don't even include. You can get a colonoscopy, but we can do a test that you can do at home of stool.
Yep, Cologuard,
stool kits to help take some of that, this is invasive, out of it and into we can do this. Yeah, nobody likes getting their blood taken, but getting your cholesterol, getting your blood pressure checked, these are all things that actually help to stave off very serious disease with serious consequences. And, whatever we can do as a health system, but also what we can ask people to do individually to get back into those primary care offices.
Yeah, 100%. I want to talk about this specifically from a systems perspective. You said something before we started recording. There's something that I deal with a lot as a prevention person, holistic healthcare and all that jazz, where I'm more looking at the value of the investment instead of the return of the investment. And sometimes it's hard to articulate, hey, me helping this person reduce their A1C by 2 or 3, 4 points means X amount of money, but in the mind it's like, well, that's not money in my pocket.
Exactly.